shows the textbook rash that occurs. It's called butterfly rash with lupus. It's more pronounced after sun exposure. The body produces many antibodies against the various body cells. That's why it's autoimmune, but mostly the cell nucleus. Immune complexes deposit themselves in the base membranes of organs. Another name for the butterfly rash is the malar rash, M-A-L-A-R. It's one of the most common indicators of lupus, while some patients also develop nasal and oral ulcerations. Yes?
What was the other name for the butterfly rash?
Malar, M-A-L-A-R. There's also something called a discoid rash, and it's basically a type of lesions that are round and disc or coin shaped that can occur anywhere on the body. Clinical manifestations of lupus: skin manifestations, the butterfly or malar rash; oral lesions, also known as ulcerations; discoid lesions; sometimes alopecia, which is losing the hair in certain clumps or areas, even not just on the head, maybe the eyelashes, eyebrows, legs, armpits. Musculoskeletal, there may be some arthritis and muscle pain, sometimes joint deformities where there may be some not clubbing of the fingers, but more like the fist may appear like bigger, or the knuckle gets bigger, but calcified. Cardiopulmonary, there may be pleurisy, which is just a rubbing of the lung tissue together. It's very painful. Dysrhythmias, also known as arrhythmias, just an irregular heart rhythm. Pericarditis, inflammation of the pericardial tissue of the heart. Hypertension, anemia, and thrombocytopenia. This patient may have issues with clotting and bleeding. Renal, there's lupus nephritis, which starts with proteinuria and progresses to glomerulonephritis. Also, renal failure. So if this is left untreated, the protein, which is excreted through the urine, damages the kidneys themselves. So a good way to test if that's happening is just to do a dipstick with those little colored dipsticks that you check for the ketones, protein, what else? The specific gravity. I don't know if you've seen those little sticks that you stick into a urine sample. You'll be able to see if there's any protein in the urine. They also do that for women who have preeclampsia, which is pregnant women who have hypertension, just to see if there's any protein in the urine. It's very dangerous and damages the kidneys, the renal system there. Neurologically, seizures may occur, and like I said, it depends on the patient. Organic brain disorder, and with the immune system, it increases susceptibility to infections. This is an autoimmune disease which causes an immune response and weakens the immune system.
What's an organic brain disorder?
Kind of like, it's like a pseudo brain disorder where there's no, diagnostically, there's no reason why the patient is having seizures, or it's mimicking like a brain tumor kind of, but there's nothing there. The butterfly rash occurs in about 50% of patients with lupus. I have a few examples of diagnoses, nursing diagnoses for lupus, so I'll write them on the board after. So to diagnose lupus, you have to have specific exam findings. The presence of an anti-nuclear antibody, or an ANA, in the blood. Sed rate is usually elevated. Erythrocyte sedimentation rate is ESR. It measures the speed at which the red blood cells fall to the bottom of the test tube. Abnormal proteins are present in the blood will sink quicker, which elevates the sed rate. And then the CRP is a C-reactive protein. Active protein, the CRP, measures the amount of protein in the blood. So as you can see, there's going to be protein in the blood, there's going to be protein in the urine, there may be protein in the kidneys coming from the, and then as a result, coming into the urine. So this is all damaging to the systems. Drug therapy begins with NSAIDs, non-steroidal anti-inflammatory drugs, which decrease pain and inflammation of the joints. And it's important that you monitor for any type of GI bleeding. NSAIDs like ibuprofen, Excedrin, Advil, they all cause ulcers, stomach ulcers. So that would be, GI bleeding would be a problem with ulcerations. So you really want to watch for that. Make sure there's no dark tarry stool, not spitting up any blood, they're not having reflux issues, maybe the beginning of an ulceration. Anti-malarial drugs will also be given. An example of that is Plaquenil. Any medications that are on these slides you're responsible for. On the slides. Whatever you read in the text, but drug-wise, it's from the slides. You could go into your text if these, which they should be in your text, these specific drugs that I mentioned on my slides, and you can go into detail in the text, but if there's a drug in the text, you won't, in the reading, which they should be in your text, these specific drugs that I mentioned on my slides, and you can go into detail in the text, but if there's a drug in the text, you won't, in the reading, you won't be responsible for that, you'll just be responsible for the ones that are from the slide. Mentions more, but I'm probably going to focus more on what I highlighted in the slides.
Okay.
Anything's game, but like I always tell you that you're responsible for all the readings in the text. There are a lot of medications that are listed in the text. You haven't done pharmacology yet. You don't have to know every single medication, but just know the important ones, which I mentioned in the slides. But as for all the other info, like pathophysiology and all the other details of the disease process that are in the readings, you are responsible for that. They have to give both things.
Okay.
Always. So Plaquenil for skin and joint. As a result of Plaquenil, retinopathy may occur. So this is important for this patient that's on Plaquenil to go for, I believe it's biannual eye exams. I know eye exams are very important. I'm not sure if they have to be done annually or biannually. Corticosteroids are really big with patients with lupus because they also have an anti-inflammatory aspect. They decrease inflammation. An example of that would be IV methylprednisone. So we know from past exams and past lectures that corticosteroids cause a lot of damage to the body. Although they help patients with lupus, they can start the beginnings of patients, like according to the exam, patients with at higher risk for developing osteoporosis that are on corticosteroids. Patients are at higher risk for developing diabetes who are on corticosteroids. So these are all important. Plaquenil will also help the skin along with the joint problems. And they may be given like a cocktail of maybe a little Plaquenil and take some NSAIDs on the side, or it's not, every patient's different depending on their symptoms. Maybe they'll only get corticosteroids for exacerbations. Other medications that they may be on often are immunosuppressive drugs, such as Imuran. This reduces the need for long-term corticosteroid therapy. they're both very strong drugs, Inurin and Plaquenil. So, sorry, not Plaquenil. Well, Plaquenil is strong too, but corticosteroids. So, you have to weigh the benefits and the risks of the corticosteroid therapy long term, and then you have to look and see if the immunosuppressive drugs would be better for the person's body. Depending on what they're suffering from, maybe the physician will pick one or the other, or switch out later on in the treatment. Investigation, targeted biologic therapy, hormones, methotrexate. And usually methotrexate is prescribed in combination with folic acid to decrease the minor side effects of methotrexate. It's pregnancy category X, which means the patient cannot get pregnant, be pregnant, plan on getting pregnant very soon if they are taking methotrexate. It's very, very damaging to the fetus. It's very important that the physician does a blood test or urine test to check if they're pregnant prior to the initiation of methotrexate therapy.
How would pregnancy complicate?
It would basically just,
No, I'm not saying the treatment. I'm
Oh.
saying how would
have pregnancy complicate lupus.
Yeah.
Very bad because they would have to switch all the medications. They wouldn't be able to take the immunosuppressants. They wouldn't, corticosteroid therapy is still like under investigation. So they would probably be experiencing the symptoms and be in a lot of pain because of the lack of medication they can take. They'll be high risk. The hormones, like the butterfly rash and many of the symptoms are related to hormones. So the hormones that surge in pregnancy would really cause it to be tough for the person. It doesn't mean that they can't have children, it just means that it may be painful or they may have a lot of exacerbations, they may have to be hospitalized. Patients that are on, patients who have lupus are also usually on an anticoagulant of some sort because blood clots are very common because of the thrombocytopenia that may occur. So blood clots are very life-threatening and they're a complication of lupus. So maybe they'll be on a baby aspirin, maybe they'll be on Coumadin, depending on their, how bad and how thrombocytopenic they are. If they're getting cut and they're not bleeding, you know that their blood is really viscous and thick. So they'll probably have to be on a stronger anticoagulant like Lovenox or heparin, as opposed to someone whose INR and PTT, PT are within normal range. So everything is just tailored to each patient. These are some other medications that may be used for patients with lupus. Really just methotrexate is one that you should know. You could just be familiar with them, but you don't have to know, like I said before, in depth. Just the methotrexate one from this slide. So this is a nursing care plan for a patient with systemic lupus erythematosus. I forgot what this what the person says. I'm in a lot of pain. I think it's, is anybody Filipino? What does that say? Is it Tagalog? Okay.
It says my face is red.
Ah, okay, so they had the butterfly rash, right? So this patient is Filipino and they're speaking in Tagalog and they're saying, I cannot say that, but I'm not even gonna try, but it's verbalized by the patient and it basically says that their face is red. Thank you, Darren. Objectively, the patient, the healthcare provider sees that they have the distinct butterfly rash on the face and that goes across both cheeks, the nose, sometimes up into the forehead. Alopecia is occurring, so there's some lack of hair. Vital signs are pretty normal. Blood pressure is 110/80, respirations are 19, pulse is 90, and temp is 37.2 Celsius. Diagnosis, disturbed body image related to presence of rash, lesions, alopecia would be normal for any woman of any age. But these patients who are more than likely women are in their 20s, 30s. So maybe they're getting married, maybe they're trying to meet someone to get married, maybe they're dating, maybe whatever. This is not a time for them to be losing their hair, looking, so disturbed body image is very, very common, and it is a priority nursing diagnosis for these particular patients. They may be depressed as a result of their body image. chronic multisystem disease involving connective tissue that appears to result from production of autoantibodies. Immune complexes and other immune system constituents combine to form complement that is deposited into organs, causing inflammation and tissue necrosis. Planning. After 7 days of nursing interventions, the patient's rash will be minimized and prevented. And the rash goes away with less sun exposure and the medications, whether it be, not usually NSAIDs, but more like corticosteroids, plaquenil, or methotrexate, an immunosuppressant. Independently, for interventions, you want to encourage the patient for good, to get good nutrition, sleep habits, exercise, rest and relaxation techniques. Suggest alternative hairstyles of wearing maybe scarves or wigs. Encourage good oral hygiene because of the ulcerations that may occur in their mouth. Teach the patient relaxation techniques such as deep breathing, progressive muscle relaxation, and maybe guided imagery. Avoid direct exposure to sunlight and encourage use of sunscreen and wear protective clothing. Advise to avoid pregnancy during the time of the disease. So the patient's going to have this disease forever. Saying during the time of the disease doesn't really make sense. It's more like during the time of the exacerbation of the disease. The rationale for good nutrition and sleep is to improve general health and help prevent infection. So you want to maintain a good immune system. To cover significant areas of alopecia for the scarf, for the wig, and that's just if the patient cares. If they may not care, that's better for them. The oral hygiene is to prevent oral ulcerations. And then relaxation techniques is to reduce emotional stress that may cause fatigue. Avoiding direct sun exposure will avoid getting exacerbations of the disease. And avoiding pregnancy during the disease exacerbation is the use of some drugs for treatment of systemic lupus can cause sterility. So these patients, as a result of the medication treatment that they take, if they don't already have children, may not be able to have children in the future. I don't know the percentages or the statistics and what exact, it's the methotrexate really that's the worst for childbearing women. And that's pretty much it. Any questions about lupus? Okay, pretty straightforward. On to dermatitis, infectious and non-infectious. So this is an example on the left of contact dermatitis. This is as a result of something on the skin. It looks like it was like a dragonfly tattoo or maybe sticker, something in that was on the skin that the patient is directly allergic to. They're going to get, in the same shape, a raised pruritus of some sort. On the right is a picture of poison ivy. Those are non-infectious dermatitis or skin disorders. So contact dermatitis is treatment is usually steroid cream, something like hydrocortisone 2%, or if it gets really bad, oral corticosteroids like prednisone. Symptom relief, cool compresses, soaks. The rash is usually pruritic, meaning raised red papules. Benadryl or other antihistamines can be given for this if it's causing some itching. Any type of contact dermatitis can last 1 to 4 weeks. And common sense, they should avoid whatever object, if they know what it is, or substance that is causing the contact dermatitis, whether it be tomatoes, whether it be detergent, laundry detergent. Another type of skin condition is shingles, but this is infectious. So those are the ones I spoke about before, like poison ivy or contact dermatitis are non-infectious. Shingles is infectious. It's a reactivation of the virus that causes chickenpox, which is varicella. It could be pruritic, which means red and raised, bumpy. It's usually very painful to touch because of the nerve endings are usually right at the surface. It sometimes looks blistery, like I don't know if anybody's ever gotten a cold sore on their mouth. It looks basically like that, but on the skin. Dermatome means it follows the nerve root, so that's where it's going to come out. That's why it's painful. And pain may last for months. Another type of skin condition is shingles, but this is infectious. So those are the ones I spoke about before, like poison ivy or contact dermatitis are non-infectious. Shingles is infectious. It's a reactivation of the virus that causes chickenpox, which is varicella. It could be pruritic, which means red and raised, bumpy. It's usually very painful to touch because of the nerve endings are usually right at the surface. It sometimes looks blistery, like I don't know if anybody's ever gotten a cold sore on their mouth. It looks basically like that, but on the skin. Varicella is the virus that causes chickenpox, which also causes shingles, but it has some relation to herpes zoster as well. Yeah, because and it's also treated the same with Zovirax. It's an antiviral medication. That's an ointment usually. They have a pill form, but for the blisters, they usually put Zovirax ointment on the shingle areas. They need a strong analgesic, maybe like Tylenol number 3, which is Tylenol with codeine, just to relieve the pain. Because even the shirt touching the area, if it's on the trunk, could be very painful. The pain is called post-herpetic pain. Neurontin is another medication the patient can take to help with the nerve pain. It blocks the nerves. Yes, same message. Shingles usually happen when your immune system is low and you've been in contact with someone with the varicella, and maybe your titers aren't that high anymore, or you've never been vaccinated for it. They come out during stress, low immune system, lack of sleep. It's more common in older people, like greater than 60. And it's contagious. It's just like chickenpox. When chickenpox is in its first stages where it's red and raised, sometimes it's like a liquid inside the papule. Excuse me. It's in its contagious phase, and then once it gets dried and crusted over, it's not contagious. Same thing with herpes. Same thing with shingles. Once it crusts over, it's usually not as contagious. They also say if it crosses the midline, that's considered contagious. So you just draw a plane right down the center of someone's body, looking at them anteriorly, and that's your midline. Anything from this side over, it usually stays on one side. But if it's covering both sides, even if it's just like this and it's on both sides, it's considered contagious. So those people are going to be put on isolation. This is tinea corporis. This is an example of ringworm. It has that ring look. It's a fungal infection. You see this a lot with children. Preschools, daycares, one kid has it, they're all touching, licking, sneezing. It's contagious. It's called an annular lesion. It could be pruritic, meaning raised and red. Sometimes it's flat as well and dry. Cats usually give it to humans. That's where it began. And it's treated with an antifungal cream, like ketoconazole or fluconazole. If it's on the head, it causes lack of hair. Like the hair, you'll lose the hair in that area, like an alopecia. and then you have to be given oral antifungals. This is impetigo. It's a staphylococcal skin infection. It's very contagious. Contact. Bactroban cream, which is an antibiotic, is the treatment of choice. It's just put all over the face or wherever it's infected. It usually occurs. Bactroban cream, which is an antibiotic, is the treatment of choice. It's just put all over the face or wherever it's infected. It usually occurs under the nose, on the chin, all around the mouth area. Cephalosporins are the antibiotic of choice orally if needed. This patient has to be on Bactroban and an oral antibiotic just by looking at the severity of the infection. This is a bacterial infection. The skin is dry, cracked, infected. It's painful, and it's more common on kids. So this is an abscess, but this particular abscess is infected with MRSA.
Is it contagious?
MRSA, very, very, very. Any bacterial infection is contagious. So this patient, it looks, see the redness? You can tell. If you touch that, it's on fire. You can just tell. It's really deep infected abscess. It may have been like a pimple that she just tried to, and then scratching it, dirty nail, scratching it, and then it just gets infected from there and just keeps going and going and going. It could be something as simple, I don't know if it would be in that area, but like an ingrown hair that gets infected from the follicle, and it gets worse from there. So for this MRSA abscess, the patient needs to be admitted. They need IV antibiotics. They'll do an IND, which is incision and drainage, and they'll send a wound culture while they're doing that just to confirm MRSA. They'll do wound packing, like I mentioned, with maybe the iodoform, which is like a long gauze soaked in an antibiotic solution. Everything will be sterile technique, dressing changes. This, they're saying, should be healed within 2 weeks. With IV antibiotics, most likely. You have to monitor for sepsis. So like I think Courtney mentioned, what happens if you don't treat it? You're going to get septic and die. Septic shock, dead. That's why it's really important to perform sterile technique while doing dressing changes, because something that wasn't otherwise MRSA could become MRSA, especially with all these bugs roaming around the hospital, meaning like bacteria bugs. You could be, practicing sterile technique and not really being sterile, touching the linens, whatever, and then doing the dressing change, and then all of a sudden the following that patient has MRSA, and it may be because of you. So it's really important to know your skills and practice the proper way to do dressing changes. So this is what an abscess is and what it would look like underneath the skin. So that's a granulation tissue which is surrounding the pus. It's kind of like what a pimple looks like. And then the pyogenic membrane, which is right around the pus, basically just a pus sac. You always have to do an IND on an abscess, because medications cannot penetrate that source. So first you IND it, and then you, like I said, then you take the medications from the inside out. Diabetic patients and immunocompromised patients, like patients maybe who have an autoimmune disease, are more at risk for developing abscess. And the last skin condition, infectious, is necrotizing fasciitis. Necrotizing means dead tissue. It's also known as flesh-eating disease. It's life-threatening. It's a fast-moving infarction, lack of oxygen, dead tissue, blood. The patient will be admitted. Surgery will be done to prevent further loss of the skin. They're going to not only incision and drain this, they probably don't maybe amputate, skin grafts, take the skin off completely. It's usually deep down into the fat that's affected. The changing skin color in the area down there represents spread that is not visible on the surface. So it may be underneath that it's affected already. The muscle and the fat is affected.
You said it's flesh eating, so it won't affect the muscle so much, right?
No, it eats the whole damn thing.
The whole.
Yeah.
Cool.
It appears from the outside as flesh eating, but it'll take the muscle, everything it can take. It's worse than osteomyelitis, and it's usually on patients that like have severe burns. You'll see this. Diabetics are more prone to it because of their lack of healing characteristics.